This episode of World Wellness Education is made possible by a production grant from the Milhorn Law Firm. Have you or a loved one ever suffered an injury due to the negligence of another? Then it's time to turn to a law firm that you know and trust, one with a record of client satisfaction and integrity. Hello, my name is Ryan Milhorn, and the Milhorn Law Firm has been representing personal injury clients in the Central Florida area for over 20 years. Our attorneys live in this community and are very proud to call it home. The Milhorn Law Firm, the law firm you know and trust.
Hi, I'm Tracy Brosman, co-founder of World Wellness Education, a community forum to educate, encourage, and inspire a better way of life. We commonly face day-to-day challenges of stress, lack of exercise, and poor eating habits. But with the right approach, we can find freedom, wake up each morning feeling healthy, focused, and ready to take on the day. Together, we can make a difference, one story at a time. It is easy to ignore the effects of poor dental hygiene, but what you are ignoring may be making you sick. Research has shown that people with serious gum disease are 40% more likely to have a chronic condition on top of it. Our guest today, Dr. Chuck Reinertsen, will share with us several patient stories of how their dental health affected other parts of their body. He will also share with us what action steps we can take to improve our dental hygiene. Welcome, Dr. Reinertsen. Thank you so much for joining us today.
My pleasure. Thank you very much.
So tell us, how does our dental health affect the rest of our body?
Well, dental health is your mouth is a pathway. It's a major highway, actually. Everybody has bacteria in the mouth.
Right.
And when the bacteria sticks to the teeth, we call it plaque. Bacteria can be really small. You can put up to 10 million bacteria on the head of a pin. That's small.
Wow.
If your gums ever bleed, and 80% of Americans do have gum disease, statistically, and you can...
80%?
80%. People don't realize it because it doesn't hurt. And people think if
Right.
it doesn't hurt, it's okay. Well, high blood pressure doesn't hurt, glaucoma doesn't hurt, diabetes doesn't hurt, cancer doesn't hurt, until it gets bad.
Right.
Then it really hurts, then you have some issues. So you can have this periodontal disease, gum disease going on, it doesn't hurt. You have bacteria in your mouth, and if you have any of these so-called micro-ulcerations, they're down under the gum, they're really tiny. Mm-hmm. Well, we already talked about how small the bacteria are. When the bacteria get alongside the tooth, they go down under the gum, and they go bloop, right in the bloodstream. And within about a minute, they go somewhere in the body and they lodge. They begin accumulating after a while. And the research in the last 3 or 4 years that has linked the bacteria in the mouth to the rest of the body has been just phenomenal. You see a direct relationship with heart issues, with strokes, diabetes, Alzheimer's, because of the inflammatory chemicals that are going through the body, Alzheimer's. There was a thing on Dr. Oz just this last week that was linking pancreatic cancer with periodontal disease.
I was just mentioning to you before the show that my father passed away from cancer, and he had terrible gum disease throughout his life, and it was pancreatic cancer.
Yeah, it's amazing how linked things are. We're just starting to put the puzzle pieces together.
We really, really need to go to the dentist. And when you guys say to floss daily and to brush our teeth, and there's more than just the fresh breath and the keeping our teeth white.
Oh, definitely, most definitely. I'm not hung up on any particular technique for keeping your teeth clean. I'm not hung up on floss, a toothbrush, anything. But I am hung up on the results.
Right.
Okay, and the results are how do you get the bacteria off of the teeth without damaging the tooth or the gums? And you can use floss, you can use a toothbrush. I love electric toothbrushes. They do so much better
I do too.
Yeah, isn't it nice? Especially if you let the timer do the full thing. Most people are in a hurry when they're brushing their teeth.
Do it 30 seconds instead of that 2 minutes.
Well, yeah, just exactly. But if you'll do some of those things, these are all helpful things that we can do.
Okay, floss, for instance. Just up and down the full mouth, or is there a better technique?
Every time I went to the dentist, they had as a kid growing up, they had a new way of brushing your teeth, a new way of flossing your teeth, and so I'm not hung up on any particular technique. If you are going to floss your teeth, which is a good thing to do, and I would recommend before people, if they haven't been to a dentist for a while, even though things are not hurting, get a good exam. See what's going on. Look under the hood of your car. I mean, if you treat your body at least as good as your car, you're going to have it checked out once in a while. So look under there and see what's going on. But when it comes to the daily maintenance that you do at home, the dental floss if you've got tooth sitting up here and you put the floss in between, if you're going to floss right, you're going to wrap the floss 180 degrees around one of those two teeth, slide the floss up and down 4 or 5 times.
4 or 5 times?
Yeah. Then wrap it around the other tooth in that space, slide it up and down 4 or 5 times, then take the floss out and go to the next space and do the same thing. What most people do is you got the tooth here on both sides, they take the floss down in there, they'll wiggle it around, take it out, and go to the next one, wiggle around, take it out. That's called popping.
Yeah.
That's not flossing, but that's what most people do. Exactly. So when I was in dental school, I thought I knew how to clean my teeth. This is before getting there.
Right.
And there were 66 students, and they gave each one of us, we said, clean your teeth as good as they can. And they gave every one of us these disclosing tablets that maybe you see, and they mark red on your teeth.
Okay.
Where it shows the areas where you missed. I mean, you thought you brushed, but you missed. And 65 out of 66 of us were embarrassed. I was embarrassed because I thought I was doing a much better job than in reality.
65 out of 66 should have had their teeth perfectly clean, right?
Yes. And the only guy who didn't, his father was a periodontist. And he understood the need of proper home care. And so his teeth were great, but the rest of us, we had to work on it. And most patients need to work on it. When I was a kid growing up and I wanted to go play outside, I had to ask my mom, Mom, is my room cleaned up enough for me to go outside? And she'd come and look at it, and her definition of clean and my definition of clean were very different.
Very
and
true.
she had to teach me. And so I have patients say, I brush my teeth 3 times a day. And I look in the mouth and I can show them where they're missing 3 times a day. So it's a matter of getting the bacteria out without damaging the tooth or the gums.
Is there if we choose flossing, is there too many times that we can floss?
You don't want to damage the gums. I've seen some people, rather than working the floss up and down, they go back and forth like that. It's a sawing action. And you can actually damage the tooth. You can damage the gums. So you can create damage in there just like you can with a toothbrush. People can get over vigorous with the toothbrush and cause all kinds of notching, and sometimes the notches can go all the way into the nerve of the tooth. So you can be thorough without being over vigorous.
Okay.
So.
And then what about brushing the teeth? We mentioned a little bit. You like electric toothbrushes. Is one electric toothbrush different from another, or does it
They
really
are. Some
matter?
vibrate, some rotate, some. But the best one for you is the one you're going to use every day.
Well,
And,
that's true.
The one that you buy that sits on the bathroom counter you don't use, it's not worth anything.
Right.
No matter what you paid for it, you have to use it every day. And I encourage people to use it brush your teeth in the shower. That's what I do. I brush my teeth in the shower. But then I don't use dental floss very often. I use probably 4 or 5 times a year. That's it.
Wow.
But I use directed water irrigation every day. But what you do is brush your teeth as good as you can. The cheek side, the tongue side, get them really clean. Then you take your water jet or water pick and aim it directly in between the teeth, not down by the gums, but right where the dental floss would go. And when the water shoots through the gum in that area, there's a physics phenomenon called the Venturi effect. And it creates a suction under the gums, and you literally suck out the toxins and the bacteria that are causing a lot of the dental disease process. Yeah. Because when you rinse your mouth after you've brushed and flossed and you rinse your mouth, you spit out, you're only getting out about 25% of what you just loosened up. The rest of it is staying in between your teeth and under the gums. So the question is, I don't want to rearrange the furniture in the house. I want to get the furniture out of the house.
Right.
And that's where the water irrigation comes in so good.
Wonderful.
Yeah.
And you can just pick that up at the store also? Or do you need to
The
get
Shower
that from your
Breeze,
dental office?
you have to buy online. We have it at the office. It's a great product. It's about $25.
Really?
Yeah.
That's very inexpensive to
It
take care
is,
of our teeth.
and if you get in the habit of doing it, again, every morning or whenever you take a shower, so you brush your teeth in the shower and then use the directed water irrigation in the shower, and all you have to do is one direction from the outside in. You don't have to get that thing inside going all over, just one direction, and you're already in the shower.
And
You don't
then
have to worry about making a mess.
Okay, so the shower pick, and we've talked about brushing the teeth. Is
Right.
there anything else? What about tongue scraping? I've heard of that before.
We can get
Is there-
bacteria on our tongue just like you can on the teeth and the gums all around there. Tongue scrapers are great. On the top of the tongue, you have these little, they're called filiform papillae. They look like little tiny hairs, and they can get coated with bacteria. And I've seen tongues that are just so coated, you take a scraper on that and you show it to people and it's like, that's on their tongue? So yes, you want to get the bacteria off of there as well. We're never going to get all of the bacteria. So
Do we really want to? I mean, isn't there some bacteria that
Yeah.
it's okay to live with? It's
Well, there are good
healthy,
bacteria
moderate?
and there are bad bacteria.
Right.
Okay, I mean, there are good people, there are bad people. Okay,
That's true.
Mother Teresa was a good person. Okay, Hitler, not a good person. Okay,
Right.
so bacteria are the same way. We got some good bacteria, we got some bad bacteria. So we
Okay.
want to get rid of the bad bacteria, and
All
most
right.
of those are the ones that go down a little bit deeper around the teeth, under the gums. They don't have as much air, oxygen down there, but they do a lot of damage. So yeah, you want to get rid of the bad bacteria if you can.
So, well, we've talked a little bit about preventative. You've told us a little bit about the health effects that can happen if we did not practice dental hygiene. But all of your years as being a dentist in this area, I'm sure that you have a few stories of people who have had something else maybe go wrong in their body and then find out it might have been related to their mouth. And you know, World Wellness Education, we're about sharing stories.
Yeah.
Can you tell us?
Oh, I can tell you a
any?
number of stories. I've had many patients over the years, and again, I've been practicing here since 1979. So, you know, we've seen a lot of people.
You certainly have.
It's very interesting being in the same town that long, and pretty soon you see some of the kids and the grandkids. You know, everybody grows up. But I had a number of people coming in with bad periodontal disease, just bad gums. And you breathe out, the teeth move out. You breathe in, the teeth move in. You know, and they're not feeling well. They're drug out. They don't have any energy. What's going on? Well, you get their dental situation taken care of, and many of them, they have more energy. They feel better. Well, their body isn't fighting this ton of bacteria that's coming in. I had one gentleman. It was funny. He thought he was dying. He couldn't put his finger on what it was, but he thought he was dying. So he had about $10,000 worth of tests run on him. This is back in the early 80s.
Okay.
And that's a lot of money, especially back in the early 80s.
Definitely.
Couldn't find a thing wrong with him. But he had this feeling that he was dying.
He was convinced.
He came in our office as a new patient for an exam, so we did an exam. Never forget this, found an abscess on one of his bicuspids. So I showed it to him on the x-ray, and I said, well, you have an infection going on up here. He says, well, what do you do? I said, well, you can either remove the tooth or do a root canal on the tooth and save it. He said, well, I don't want to lose it, let's save it. So we did the root canal on the tooth, and within 2 weeks, he was fine. He felt completely, he said, that was it. I never would have guessed that little infection was doing it.
Wow.
But within 2 weeks of doing the root canal, he felt just fine. So.
And he'd been feeling rotten, and nobody could find anything.
Nope.
So it wasn't showing up in any of the tests?
No, I wouldn't have guessed it, but there it was, and there's the example right there. I mean, he did it. I've also had patients talk about other examples. We had last year 2 patients that had friends of theirs that had to have a hip replaced because the hip was infected. When they did the surgery, they were able to trace the infection right back to the mouth. So the bacteria in the mouth go through the body. They begin lodging in different places, and they can cause other issues. When you replace someone's heart valve, what's wrong with the old heart valve? It's full of bacteria. Well, what kind of bacteria? Well, they're the same ones you find in the mouth. How do they get there? Well, let's see if we can have some common sense there and see how it got there. You know, so if we can close down this pathway, it seems to help the rest of the body a lot. So we don't want to have any unnecessary surgeries if we can avoid them.
No, absolutely amazing. So we really need to take care of our teeth much, much better.
The American Dental Association did a great big study back in the 90s that shows that people that hang on to their teeth on the average live at least 10 years longer. Think about that. People that take care of their teeth on the average live at least 10 years longer. That's a big statement.
That is a huge.
Yeah.
Well, I'm glad that I continue to get raving reviews from my dentist.
That's good, yeah.
I'll continue working really hard at that.
Yeah, that's great.
Focus on that at least. Now let's talk about mercury fillings. I know that a lot of people have mercury in their mouth, and you hear, you know, that people are having the mercury removed. And when is that a good thing to do, or when would you suggest?
Well, you can find experts on each side of that.
As
debate
with
right
anything,
there.
right?
As with, there you go. But what we generally recommend is if the fillings are doing good and people are not having any symptoms, they don't have any medical issues that they're aware of, I don't want to go in there and disturb things. Now, if the filling is breaking down, if it's leaking, if there's recurrent decay around it, obviously you're going to take that one out and replace it.
Right.
Now, I haven't used the silver mercury fillings for at least 12 years because we have better materials.
Right.
And that's my reason for not using them. We have better materials now. But
but what if they were feeling, low energy or having some other health effects? Maybe they have cancer or heart disease or something like that. Would you look at replacing the mercury?
well, the first thing you'd
fillings?
want to do is get some nickel or mercury sensitivity testing, because
And what's that?
they can test you to see if you have a sensitivity for mercury or nickel or some of the other metals that are in there.
Okay.
Because in the filling you have silver, zinc, copper, a couple other things, mercury like you talked about.
Okay.
But the mercury is all bound up.
All right.
So I don't recommend going in and replacing every silver mercury filling that we see. I don't know that we're doing people a service. I had a patient back when 60 Minutes did a thing about how bad silver mercury fillings were back, could have been the late 80s, early 90s.
Right.
And I had a patient with MS come in. And he wanted all of the silver fillings taken out of his mouth because he felt that was going to help him. So we talked to him about it, and we did that. We took all that out, but he couldn't afford crowns, and so we put temporary restorations. We took care of all of the silver and the mercury, got all that out, and it didn't help him a bit. And
Right.
so for him to do something like that, he was actually in worse shape afterwards, because now he didn't have the fillings in the teeth. He had to figure out what he was going to do, so he ended up removing a lot of the teeth. And so it wasn't a good experience to take out all the old silver mercury fillings in his situation.
Right.
However, I do know people that, in fact, I know one particular individual that only had one silver mercury filling, and she wasn't feeling good for quite a while. Had that one replaced, and she felt fine after that. So I kind of look at it like penicillin. Some people can't take penicillin.
Right.
Well, we don't throw away all the penicillin. We figure out who can and who can't.
That's
And
very true.
I think that's a more practical way of dealing with this silver mercury fillings.
Now, you mentioned that there's a test that people can take to see if they're sensitive to it or not. How do they go to their general practitioner, or how do they get that test? Is that something you can do?
Yeah, we can do it. There are a number of different places you can go to have these. They're simple tests, and there's debate as to how accurate these tests are. What did you have a couple days ago to eat? Is that going to throw things off? So,
Okay.
but that to me would be the first step. I had a discussion with one of the holistic doctors in the area who's just excellent.
Yeah.
And we got to talking about the silver mercury fillings, and he said, "Chuck, it's going to bother people." And I told him, I said, "Well, I have over 250 patients in my practice that are 90 years old or older, and most of them have a mouthful of silver mercury fillings." And he said, they may be 170 before it bothers them, but eventually it will bother them. So we both had a good laugh over that. So some people are just more tolerant than others.
Right.
So.
Let's talk about root canals. What exactly is a root canal?
A root canal is, the way a tooth is put together, you have the root of the tooth and the top part of the tooth, but in the middle of the tooth there's a hollow chamber, and in that hollow chamber you have the nerve and blood vessels and the lymphatic system, but that's what keeps the tooth alive, keeps it healthy. When you have decay coming in from the outside, from the enamel, it works its way through the dentin, and once it gets close to the pulp, it infects the pulp. And that's when people will have a toothache, or they might start having some sensitivity or some lingering pain after hot or cold or something, chewing on it. But you have an infected or dying nerve. What a root canal does is you go in and you remove the infected tissue that was in the middle of the tooth. You clean all of that out, and then you fill it up with a root canal filling. It's an inert, we use gutta percha, which it doesn't react to anything. So you put it down in that, and so in one sense you have a dead tooth. There's no more blood supply going to that tooth at all. But you still have a very functional tooth. I had a cracked tooth on my upper right. Cracked it when I was in dental school. And, ended up having a root canal on it. I can still remember the toothache before. The root canal was fine. The toothache before was a killer.
Right.
But I had the root canal done, have a crown on the tooth, and that was 1980 or 81. And it's still there, doing just fine. So all you do is take out the nerve, clean it up, put the root canal filling in that, and that's a root canal.
Wow. So what happens if somebody was told that they needed a root canal and didn't go and get a root canal? What kind of things how can that affect the body?
That's a great question, because a lot of times people will use pain as the indicator for whether they should go back or not.
Yeah.
A lot of teeth can have abscesses on them, and you never even know it. You may have just a metallic taste in your mouth once in a while. You don't even have that taste. So Yeah, the consequences of not having the root canal done, and you need to either have the root canal done or the tooth removed. You need to remove the source of the infection. And you've got to get that out. If not, then the bacteria, they just keep dumping right into the bloodstream, and they start affecting other parts of your body. So yeah, just because it doesn't hurt doesn't mean it's okay. And I wish a lot of these things hurt worse than they do. I've seen have patients come in and their teeth are just bombed out down to the gum line. They never had a first toothache.
Wow.
Because it was draining out. There was no pressure being built up. Do we like that? No, we like health.
No. Well, and with our health, if things hurt worse, we would take care of things.
Yeah.
If we immediately got a stomach ache when we ate something that wasn't healthy for us, we wouldn't be going back for it,
Yeah,
right?
that's exactly.
But instead, we don't get that feeling.
No.
And by the time we're feeling ill from it, we don't correlate that it was the food or it was our dental hygiene or the fact that we haven't exercised or the fact that we're not getting any sleep or we're too stressed out.
Yeah.
We have no idea. There's way too many things to think about, right?
Yeah.
Is there anything else that you'd like to share with us as far as our dental hygiene that we should be aware of that maybe our dentist might not be talking to us? You don't have time all the time to tell us in the chair and
Well,
to get out.
don't be afraid to look in your own mouth. I mean, don't be afraid to get a flashlight and pull your lip back and take a look around there and see what's going on. You'd be amazed how many times we'll pull a lip back and just show someone, see this? And they're like, oh my goodness, it was very visible if you just pull the lip down. But yeah, don't be afraid to look in your own mouth and kind of see what's going on.
So, well, with that, what should it look like?
Well, the gum color should
Okay.
be what they call a coral pink. It should be a nice coral pink color. The redder the gums are, the more inflammation is going on. So when you look at them, you see it's red and puffy all around by the necks of the teeth. That's not good.
Now, what if it's really pale?
Is it bleeding or not?
Okay.
You know, if pale is not too bad. I mean, pale, that could be very, very healthy, actually.
Okay.
So you just want to see, do we have puffiness? Do we have, is it bleeding easy? Do we have pocketing going around the teeth? So yeah, as long as they look pink, that's a nice pink. And then when you take your floss in between the teeth, when you take your brush there, do the gums bleed?
Okay.
Because if the gums, they may bleed, but it doesn't hurt, so you don't even know it's bleeding. So
Right.
floss in there, take a look, oh my gosh, it's bleeding. And maybe you need to follow up a little, change your technique a little bit, or maybe see the dentist.
Okay. And we should be seeing the dentist how often?
That's an excellent question right there.
Yeah, because you hear different things, right?
There is no one right answer. It all depends on the individual. There are most people we see a couple times a year for a hygiene visit and also an examination, because the importance of the regular preventive visits are that you're going to, if there should be a problem, you're going to catch it when it's small. You're going to be able to clean those areas that people think that they're cleaning at home, but they're actually missing, and you can just make the expenses in the future much less, the comfort much greater, and the inconvenience, well, you're not going to have that unexpected toothache. So there's a lot of things that you can do to just prevent the problem.
Your time?
Yeah.
Well, and you mentioned prevention. How much of your time is spent educating patients and really working on prevention in your practice?
Oh, a lot of time. In fact, the whole staff works on it. Our hygienists are educating people, all the time. The dentists, as we go in and examine patients, we're educating them. But that's the key. You have to first understand it, and then it makes the motivation a whole lot easier. And I tell people all the time, would you rather change the oil or replace the engine?
I'd rather change the oil.
Yeah, replacing the engine gets a little bit expensive. It's certainly
it's a lot more time consuming,
Yep.
and like you said, inconvenient.
Yeah.
Well, let me ask you, if somebody watching this show would like to find out more about you or ask you some questions or even make an appointment, how would they do that?
Well, you can call us at our office. It's Tavares Dental Excellence. We're in Tavares, right on Highway 441. The phone number is 352-253-6400. And the website is tavaresdentist.com. And you can look and find information on that.
Great. Well, thank you so much for being here with us today and sharing your stories and also how we can prevent maybe some future dentist visits and doctor visits as well.
Well, let me give one thing real quick.
Yes.
If they want more information about oral systemic health, there's a website called American Academy of Oral Systemic Health. It's AAOSH.org. There's tons of information there for the general public.
Well, thank you for sharing that.
Yeah.
I really appreciate that. Thank you, Dr. Reinertsen, for joining us today. I really appreciate you being here and sharing everything today.
Oh, it's been my pleasure. Thank you very much.
Together, we make a difference, one story at a time. If you would like to find out more about World Wellness Education, visit our website at worldwellnesseducation.org. Toxins are everywhere. There are toxins in the food we eat, the lotions we put on our skin, and the water we drink, and the air we breathe. With so many toxins in our lives, is there anything we can do as individuals? Why would we care? Today's tips will help you understand why it is important to eliminate what toxins you can and easy ways to do this. In order to motivate you to change things in your life, you must first understand the why. Toxins are implicated in almost every disease. A study in 2005 reviewed the umbilical cord blood of 10 newborn babies. They found an average of 287 toxins in the blood, and 200 of these toxins were industrial chemicals and pollutants, including chemicals known to cause cancer, poison the nervous system, brain, and cause birth defects. And this is the blood of a newborn baby. Just imagine what is lurking in your system. Pesticides have been associated with Parkinson's disease, environmental toxins have been linked to chronic kidney disease, aluminum has been associated with Alzheimer's disease, and bacterial toxins have been connected with diarrhea. And the list goes on. You know it is time to eliminate as many toxins from your life as possible when you feel sluggish, have skin problems, or aches and pains. Other indications would include disease, digestive problems, as well as difficulty losing weight. Do any of these sound familiar? So where do you start? My suggestion is to start by making small changes in your life. Make one change a month and you can really make a difference in your health. Let's look at a possible plan. Start with your body. Did you know that things you put on your skin are in your organs within 28 seconds? Have you ever looked at the ingredients of the lotions, creams, makeup, etc. that you put on your skin? Most of these items are extremely toxic. However, with a little research, you can find a number of companies that provide toxin-free products. The plan to change one thing a month might go like this. Month 1, replace your lotions with non-toxic options. One possibility is to use coconut oil. Month 2, check the toothpaste you are using. Have you ever read the fine print on your toothpaste tube? It says to call poison control if you swallow it, and you're putting this in your mouth. Replace your toothpaste with one that is non-toxic. We even have a simple recipe for homemade toothpaste on our website at worldwellnesseducation.org. So the plan is to remove the toxins from your life one at a time, 1 month at a time. This information is not meant to be medical advice. No action or inaction should be taken solely on the contents of this information. Instead, you should consult appropriate health professionals on any matter relating to your health and well-being. Thanks for joining us. Remember, you can catch this show each week on Lakefront TV. To find out more about World Wellness Education, check out our website at worldwellnesseducation.org. And we'll see you next time.
This episode of World Wellness Education is made possible by a production grant from the Milhorn Law Firm.
We at the Milhorn Law Firm believe that important decisions in planning should not be put on hold. These planning decisions affect not only you, but your children and heirs. My name is Eric Milhorn. I'm one of 7 attorneys here at the Milhorn Law Firm. We've been very fortunate. We've been able to serve the Central Florida area for a period of over 20 years. All the attorneys at the Milhorn Law Firm live in this area and are proud to call this area our home.
The Milhorn Law Firm, the law firm you know and trust.